Welcome to this training video on challenging behaviour, which is in conjunction with a handout that hopefully you have when you're listening to this video. Now, if we're really honest, I think we can acknowledge the fact that we can all be challenging at times. You know, there's situations where, in retrospect, you can just accept that your behaviour wasn't what you'd hoped it had been when you're thinking back about a situation that you were in. And often we can reflect on those moments when we've behaved in a kind of inappropriate way, and we can work out the reason why we were provoked to be a little bit extreme in our response. And I think it's really important in terms of starting to reflect on working with people that do exhibit this label of challenging behaviour, that we acknowledge that it's all part of our lives as well, that we can be challenging. Human beings can exhibit challenging behaviour, and the people that we care for are no different than us in that fact. And I think it's also fair to acknowledge that, some of the situations that our residents are in, that we might get very challenged by what they have to put up with in terms of, sometimes being just sitting or in their bedrooms, and a kind of group of people come into their room, a couple of people maybe, and then start taking off their clothes and messing around with their bits and pieces. I mean, if you're watching this video and there's someone just near you comes across and starts putting their hand towards your trousers, I mean, there's going to be some people here that will react in a very aggressive way, in a very defensive way. And I think it's really important in terms of managing challenging behaviour that we acknowledge that the types of interventions that we are carrying out are very invasive, that you are, in a sense, breaking that kind of defensive barrier we have about our bodies. You're just, in a sense, invading their private space, and if our private space is invaded, we will react. And that's, in a sense, what our residents are very often just responding to, an invasion of their personal space. But we think we've got a just cause, and therefore we can carry out that intervention, not realising that, you're breaking a boundary there. In a sense, a boundary has been lifelong. And I think managing challenging behaviour is very much about acknowledging that this is what's happening very often. That we're breaking a boundary that has been long established, and it's a defensive response. And I think, if we're going to create an environment in terms of, caring for people that do become quite challenging, then we have to, in a sense, acknowledge that and try and understand what was the potential cause of that response. There's always a cause. There's something that can explain why someone has behaved in the way that they have, and that's our job to try and do so. There are 4 key areas that have been highlighted in the handout that have been given to you, and I want to go through them sequentially. The first one, and I think it's really important, is that, when we're experiencing some challenging behaviour from one particular resident, that we need to respond in a really thoughtful way and start to think about and explore what might be causing it. In a sense that, and lots of times when you don't do this, you can miss some very obvious possible causes. And what I'm thinking of is some basic medical reasons why someone would be, without realising it, provoked to be aggressive and impatient and thrashing around. And it might be, for example, that in client groups who are a little bit older, then they're more prone to things like constipation and urinary tract infections, that we should, as professionals, start to be thinking this from the very, very start. Why are they behaving in the way that they are? And might there be a very basic physical cause for that? And we should be looking into that to start off with. What is the trigger? It can also be that individuals may have different diagnoses, and that we might need to get the psychiatrists. We have an excellent team called the Older People's Mental Health Team in our area, people with a lot of experience, and there might be that a little bit of tweak of medication might just allow someone to be just a little bit more calmer in themselves, and that might be helpful. Certainly, let's be clear, there's nothing in our philosophy of care that would lead us to be trying to medicate people into some sort of robotic sedating state. That's not what we do, and would never want to do that. But there is opportunities to use medication just to make people feel a little bit more at ease in life. And sometimes that's necessary, because with some of the people we're working with, a talking response, that interaction with an individual has been inhibited in such a way that it doesn't allow any progress in that direction through kind of verbal discussions and calming techniques. And so in that situation, sometimes medication is the only option. And as our basic first response to challenging behaviour, we should be looking at this kind of package of things, physical causes, whether or not we can make some slight changes to medication, bringing in professionals that help us to do so, that we should be looking at that in the first instance. Because, in a sense, there often is some very, very basic causes. In the care of the client group we look after, very often those kind of things, bowels, being dehydrated, they're a cause. Challenging behaviour can be just the first consequence of that, and that we should be looking at that very much from the first. And that's a very important point that we need to highlight. Okay, the second point on your handout highlights, in a sense, the responses that might help you to deal with a situation where you find yourself challenged by someone's behaviour. And I think that the very first issue that someone caring for a person exhibiting challenged behaviour should consider is their own safety. It's essential that you don't put yourself into a situation where you could sustain an injury. The carer needs you. You can't help them if you're not at work. It just doesn't make sense to be in a room with somebody who's exhibiting challenging behaviour that you couldn't cope with physically yourself, and it will put you at severe risk. So you should kick yourself out of the room. Very, very clearly. Don't put yourself at risk. I think the other thing, again, a basic kind of management strategy, a care management strategy, is that where someone has been exhibiting incidents of challenging behaviour, then you shouldn't go in the room with you on your own. In a sense, you need someone with you. One, to ensure your safety, but two, also just to provide that support should something get out of hand. So I think that it's very, very important. There's plenty of people at work with you, colleagues, and so why not utilise the resources we have? And if there is somebody that exhibits challenging behaviour, make sure you've got colleagues to help you. I think the next very important kind of strategy, I suppose, which can be very helpful, is just the importance of staying calm. That if you are in a situation where someone is being very animated, very aggressive, thrashing around, then it doesn't help if you become a little bit anxious and defensive and probably a bit aggressive yourself. Sometimes an incident where someone is provoking you can cause that kind of fight and flight response where you become protective. And that doesn't help either, really, in those situations. What really helps is a kind of level of calmness, that you can respond to someone in a very even voice, in a very kind of protective voice, and just provide that kind of buffer to the aggression you're getting. And if you don't feel in that place, again, get out. Don't stay there. Go outside and just have a few deep breaths if you need to, and then come back in later, or come and get some support. Stay calm. Very important. There are also kind of distraction techniques you can use. I think that at the other time a bad joke can work. It can deflate a situation. Or, just asking the person to think of something different, or to think of just maybe even say, talk about their family member, and that can bring someone down a bit from a heightened level of aggressive, challenging behaviour. So distraction techniques are very, very important. There's one of the residents of these fields where, you probably know who I'm talking about, but if you start talking about the weather, you can deflate the situation. Give a cup of tea or something like that. Those kind of distraction techniques should not be underestimated. They're really important. So you stay calm and just try and break the kind of intensity of the situation a bit. That can work really, really well. The other thing that's really important is in a sense, communication as a team. It's very important that, say for example, you found that conversation of the weather can break someone's challenging cycle. Well, then pass it on. Write it down and make your colleagues aware that you can work. This works. I've been in the room and this person was really intense, and if you start talking about the weather or give them a cup of tea, you kind of deflate the situation. Can also be, for example, that a gender of the carer can provoke someone, and you can go out and get a colleague and they come in the different gender, and it's absolutely fine. And don't take that to heart. That's just the way that you can deal with a situation that's challenging. As a carer, we're looking for these kind of answers all the time. We're trying to look for what are called triggers. We're trying to see what triggers the aggressive behaviour, and as a consequence, what distraction technique we can use to deflate the situation, to just bring the calmness to the situation in terms of how we respond and how the person is responding to you. It's about trying to just work that kind of thing out. And it's really, really important. The other thing that's really important is that we recognise that we live in a community, and that if people exhibit challenging behaviour, what effect it might have on the other residents, and what strategies might we need to make sure that they're safe. The extreme level is that if somebody is particularly aggressive and can be aggressive to other residents, then they may have to be excluded from communal rooms. And then we might need to look at assistance from our colleagues in older people mental health to see whether medication is needed. But we just need to be thinking through the way that a challenging behaviour exhibits itself, to plan how we might cope with eventualities that are either with the carers in a kind of personal care setting or in communal situations. That needs to be thought through and put in their care plan. We need to think that through. The third point on your handout is the principle of containment. And it's really important. It's a kind of subject area which plays a big part in the psychotherapy world. The whole idea of containment, and it originates from that kind of environment that is created in a family, for example. That children are brought up in a situation where parents, ideally, sometimes it's a struggle, they are able to create an environment for children to be brought up where there's not a tolerance of bad behaviour, but an acceptance that it will be managed in the family, that nothing will be too disruptive, too horrendous, that it can't be managed by a family situation, by parents being loving and caring, using discipline when necessary, but contain behaviour so that as a nurturing experience, a child can develop into an adult who understands what is right and what's wrong. And that's the principle of containment. And I think that what we're trying to do at Eastfields, I mean, it's very important that we're trying to create a containing environment. And I don't think it's necessarily, appropriate to start comparing the residents with children. I think that's wrong. We don't want to infantilise our residents, but we want to create a setting where we can manage and create an environment which is worth living in, that issues like challenging behaviour can be worked through. It's not going to bring the place down. It's never going to be that bad that we can't find a solution. That it's a caring setting where the intention is to create an environment that's worth living and worth working in, and is enjoyable, it's fun. There are times when it gets a bit stressful, it gets a bit kind of anxious, and there's obviously always going to be some conflicts amongst staff, amongst residents. That's always going to happen. But the experience of it is not going to bring the whole place down. That in a sense, it's going to be contained, and it's going to be a place which will get back to normal, and again will be fun to be in. And I think that principle is really, really important in a care setting. The people here are invested in living here and working in here, and as a consequence, we should recognise that we have a part to play to make it a containing environment where it's worth living in. And that's really, really important. And the underlying ethos between managing any type of problem, but particularly challenging behaviour, that people, if that's because they have an outburst of behaviour which they wish they hadn't done, or maybe they can't work it through, it's not going to mean they're going to be stigmatised. We're going to be containing it. And I think that's really, really important. The fourth point on your handout is one that we've talked about as colleagues many times, but I think we just need to go through the principles, the legal principles behind caring for someone who exhibits challenging behaviour, because it's clear that when you are working with someone that can be very aggressive towards you physically, starts trying to punch you, that before the punch is landed, you're going to have to go no, but otherwise you're going to get punched. So that movement of putting your hand up to stop the punch could be seen as a restraint. You're restraining the person, you're stopping them from doing something. They're trying to hit you and you're stopping them. And that's the basic principle. And of course, you have a right to do so, because otherwise you're going to get hurt. But if you're trying to restrain people in terms of leaving the room and perhaps making them stay in the room, because you don't want them to hurt other people, there's in a sense a basic legal principle that we need to work through in terms of just making sure that the strategies that we're using to restrain a person from harming another person, harming you or another patient, that they're appropriate. Because we're depriving the person who's being challenging of their liberties because they want to do something and you're stopping them from doing it. So it's a deprivation of their liberty. And we understand, as you know, that the kind of Mental Capacity Act, which underlies a lot of the work that we do, puts us under a legal responsibility to go through a process to protect the person that's being deprived of their liberties, to protect them and also to protect ourselves, to make sure that people that understand and agree that we're taking the appropriate measures. So we need to go through the deprivation of liberties process. And what that means is that as soon as you go into that incident, and as soon as you end up having to restrain a person, immediately we should be applying for a deprivation of liberties authorisation. And what that means simply from a carer's point of view is that you need to be mentioning it to me, for example. It's my responsibility to apply for that authorisation. And I will fill in a form and send off the authorisation, and then the local authority will then come in and they'll look for our care plans, they'll look through the actions that we've taken, and they'll either agree what we did was appropriate, or they'll give us an instruction of how we should act differently if that were the case, and hopefully that's not the case, because I think we do that quite well. But that's the process we need to go through. Okay, so in a sense, this training session probably is only really going through a lot of the basic principles that we use every day at Eastfields. But sometimes it's worth talking about the everyday, because, you know, in a sense, in amongst the everyday are human beings that are living and trying to exist within the nursing home. And if we don't think through our processes, sometimes they can become a little bit impersonal. And that's not what we want at all. And I think everyone agrees with that. We want an environment which is fun to be in, that people are treated as human beings in their own right. And there's no, in a sense, thoughtlessness, which can often emerge when you just start to do your job without thinking about it. And I think that's the reason why a kind of conversation needs to be had about challenging behaviour, working with challenging behaviour, and hopefully this training video gets you going talking about it. Thank you.